Upper limb impairment affects most patients at the time of stroke, with persisting problems for between half and 3/4 of survivors. But because of regaining lost function in the upper extremities has been found to be more difficult to achieve than the return of normal function in the lower extremities, only 14% of those with initial difficulties will regain any useful function. Between 55% and 75% continue to experience upper extremity functional limitations. There are strong indicators from the research that because of the extreme difficulty of regaining function in this area, a quite aggressive retraining paradigm in terms of input should be adopted. And this is exactly what is presented in these next series of exercises and techniques. There are no coping strategies to be found within this upper body video in favour of intensive task-related practice. However, the evidence shows that developing coping strategies are, to a large extent, anti-process for upper body rehabilitation. Researchers note that only upper limb interventions that incorporate functional task-orientated training can lead to improvements in dexterity. For example, to button a shirt, the shoulder and elbow must help to position the hand near the centre of the chest, and the forearm and wrist orientate the hand so that the fingertips can make contact with a button. Only after the hand is appropriately positioned and orientated can the fingers manipulate the button through the buttonhole. If a joint cannot be moved alone or cannot be held still when it is not supposed to move, then the ability to use the hand for functional activities will still be limited. The hand is one of the most fascinating and sophisticated motor systems your body possesses. The non-stroke survivor's fingers can be straightened or curved into hundreds of various positions, and the thumb can meet every part of the finger on the frontal surface. For stroke survivors, however, the muscles limit movement. The soft tissue shortening of the long finger extensors is posited to be the most limiting factor to regaining hand function. This is spasticity. While not everybody will develop spasticity, it's the most common upper limb difficulty after stroke. Even though full recovery is difficult to achieve, I must tell you that you really can still do very well indeed by maintaining the range of movement and function in your affected limbs, and by seeking to decrease spasticity, if you have it, by the sort of training you will find in this next section. I know that your hand may seem the hardest of all body parts to achieve movement with, but I'm here to tell you that you can regain a great deal of movement, however hard it may seem initially for any results to come through from your training. As an instructor, I need to promote an increase in active range of motion in as many planes and pivots as possible. It is important that we focus on raw movement. In brief, the assemblage of increased active range of motion of various pivots leads to the potential towards other recovery options that can then lead to more active range of motion. Okay, now keep body still and straight up to here. Touch. Good. And down. Good. And we go up. I'll touch my hand out there. Come on, touch hand out there. Touch my hand out there. Well done. Good, good. And we go up. Touch, 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 touch. Good. And we go. Where are you going? We go.
I'm tired.
Touch. Up, 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 up. Good. And we go up, 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 up. We're done. Good. And we go up, 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 up. This is the last one. Well done. Okay. So let's look at the approach. I think you need to be a bit clever about all of this. In real terms, you need to emphasize training on isolated finger activities, incrementally increasing the difficulty of movements over time. A very tough ask, I know. Now, around your 3 or 4 weekly training sessions, you should be aiming to start challenging yourself at least 10 to 20 times every day with doable, simple tester tasks around the house with your bad hand. These need to be as varied as reaching for, holding and switching on an alarm clock to pulling up and pulling down a lavatory seat. When starting out, please don't do potentially dangerous tasks like cutting fruit with your bad hand. I don't want you to damage your arm or hand. but you must challenge yourself safely. Don't hide your bad hand away in a specially cut out pocket in your sweatshirt, please. I've had a few stroke survivors who've done this, and this is the wrong thing to do. Instead, wear a big chunky heavy watch on your bad hand with the face on the underside of your wrists so that you have to look at your bad arm and turn the wrist to read the time. I've personally found that the heaviness of the watch can also serve to make me more aware of my bad hand. Try it and you'll see what I mean. So in training, do you work just your bad hand or attempt to use your good hand in the mix sometimes in order to guide, help, promote and nudge? What about using both hands in tandem? In the literature, this is called bilateral training. The idea behind it is that symmetrical bilateral movements activate similar neural networks in both hemispheres of the brain. So when you use the same muscle groups on the good and bad side simultaneously, activation of the undamaged hemisphere may promote neuroplasticity and activate the damaged hemisphere. There is an interesting caveat to bilateral training, which is that the movements you need to make do not necessarily need to be exactly the same on both sides. For instance, if you push one arm away from the body and pull the other in, this is not symmetrical activity, even though it is done at the same time. But the signs are that in the brain, it seems to be as effective for neuroplastic purposes as doing the same things with both limbs at the same time. I would also show you on this video how you can use a method that I've termed the minimal assist way. This is the way in which you can work the edges of your current movement capability, firstly with no assistance from the good hand, and then add some slight prompting from the good hand when seeking to complete the task or extend the set. My minimal assists method is a way I use to rehabilitate my own hand.